Hey, how's it going?
Good, but I think I have some issues with my medication for my type 2 diabetes right now.
Yeah, I'm looking at your results right now and your blood sugar levels are still too high. So I think let's try something else instead of metformin.
Okay, that sounds good.
Let's see here. I think I'll prescribe you semaglutide.
I think I might have heard of that before. It's like the weight loss drug, right?
Yeah, well, semaglutide was developed for type 2 diabetes patients. It became FDA approved in 2017 as an injectable called Ozempic, and in 2019 as an oral medication called Rybelsus.
Okay.
And it's been shown to lower blood glucose by stimulating insulin secretion and increasing insulin production in the body.
Are there any side effects with the new medication?
Yeah, there's some common side effects. They mostly include GI issues, nausea, vomiting, diarrhea, and increased heart rate. If you notice any extended dizziness, fever, or confusion, please call the office immediately.
Okay, that sounds good. I don't think the side effects are too bad.
Do you have a preference between a pill and an injection?
Ooh, I am scared of needles, so I think I'll go with the pill.
Sounds good. I'll send a prescription for Rybelsus to your pharmacy.
Okay.
I'll also send you some resources if you want to look into this more. I'll see you in a month for your next checkup.
Okay, sounds good. Bye. Hi.
Hey, how was the appointment?
It's good. They prescribed me new medication. It's kind of like Ozempic, if you ever heard of it.
Oh yeah, I think I've seen that all over my TikTok for you page, but it's not for weight loss?
No, this one, it's for type 2 diabetes. Yeah.
Nice.
Yeah, my doctor sent me a video about it if you want to watch together.
Okay.
Do you have type 2 diabetes or are you overweight with a cardiovascular condition? Try semaglutide. This once-daily pill or weekly injection can stimulate insulin secretion and lower blood glucose. Side effects may include nausea, vomiting, diarrhea, loss of appetite, fatigue, blurred vision, and increased heart rate. Seek medical attention immediately if you experience confusion, fever, weakness, yellow eyes or skin, or suicidal ideation. Semaglutide may increase your risk of developing thyroid cancer. Do not take semaglutide if you are allergic to any of its ingredients. Semaglutide can be dangerous if taken prior to undergoing anesthesia or when taken with alcohol. Weight loss results may be affected if semaglutide is taken simultaneously with antipsychotics. Stop taking semaglutide if you experience throat swelling or rash, an infection at the injection site, or are planning to become pregnant within 60 days. Ask your doctor if you think semaglutide is right for you.
That was so educational. I think I'm gonna make us a healthy dinner now.
Okay, I'll find something for us to watch.
Sounds good.
I actually had something I wanted to bring up with you since we're hanging out.
What's up?
I've been taking some new weight loss drugs and I haven't seen any results. And since you're a registered dietitian, I wanted to know if you could answer some questions I had.
Well, what have you been taking?
I've been taking semaglutide pills for a couple weeks now and nothing has changed.
Semaglutide pills? Are you sure? Do you have type 2 diabetes?
No, I've heard it's good for weight loss.
Are you sure you're not thinking of Wegovy? It's, semaglutide is only approved for weight loss in an injectable form.
Well, my roommate has a semaglutide pill for diabetes, and I've seen online that it could be used for weight loss, so I borrowed some because I'm trying to lose some weight. And then when I ran out, I found some online.
Well, I can tell you why you wouldn't lose weight doing that, but you would lose a friend. Firstly, knockoff pills are really dangerous because they have lots of random ingredients that they don't tell you about in them. And secondly, it was a prescription for your friend for a reason.
Yeah, I do feel pretty bad about it, but I still don't understand why I haven't lost any weight.
Well, you stressing over stealing pills definitely is not helping. Semaglutide only works for weight loss, especially when combined with lifestyle changes like dietary restrictions and increased physical activity. It's usually only prescribed with instructions to change your diet to a reduced carb diet, healthy diet, and exercise at least 150 minutes a week. It's also recommended to meditate and do some yoga to reduce high cortisol levels, which are the cause of a lot of weight gain.
I didn't realize any of that. I should probably apologize to my roommate and throw those meds away.
That would be good.
In this informational video, we will be covering semaglutide's mechanism of action as a GLP-1 receptor agonist, what GLP-1 is, pharmacological properties, how it can be used for weight loss, statistics, and social impact.
Today we're going to discuss the mechanism of action of semaglutide, which is a GLP-1 receptor agonist. Now, to talk about this, we have to talk about GLP-1, or glucagon-like peptide 1, which is an incretin hormone produced by the pancreas and central nervous system, meaning it's secreted after nutrient intake, like after you eat, and helps to stimulate insulin secretion, which helps to lower blood glucose. In particular, GLP-1 can trigger the adenylate cyclase metabolic pathway, leading to high levels of cyclic AMP, which activates the protein kinase A. PKA can promote insulin-containing vesicles to leave the pancreatic beta cells, where insulin is produced and secreted, which can help to increase insulin secretion and lower blood glucose. Now, the activation of the GLP-1 receptor can promote the neogenesis or creation and decrease the apoptosis or death of pancreatic beta cells. It can also inhibit the release of glucagon, which can help to increase blood glucose levels. And then, in addition, GLP-1 can also help to reduce inflammation, which can aid in treatment of obesity if it is being used for that. And then GLP-1 receptors can also be found throughout the brain, which help to regulate appetite control and satiety. Now, the main role of a GLP-1 receptor agonist like semaglutide is to activate the GLP-1 receptor and produce the effects listed before in order to treat type 2 diabetes, or in some cases treat obesity and achieve weight loss.
Semaglutide is a polypeptide made up of 31 amino acids joined together by peptide linkages. It is similar to the human-produced amino acid known as glucagon-like peptide, also known as GLP-1. And the only differences between these two is that in GLP-1, there is alanine at position 8 and lysine at position 26. But in semaglutide, the position 8 alanine is replaced by AIB, and then this prevents enzyme breakdown from the enzyme dipeptyl peptidase 4. And as for position 26, the lysine is binded with the C18 fatty acid chain, resulting in albumin binding, and then this allows the drug to stay longer in your blood circulation.
I'm going to talk about the pharmacokinetics of semaglutide. In terms of absorption, the absolute bioavailability is 89%, which is the rate and amount of the active drug that reaches its target location in the body when taken non-intravenously. And the maximum concentration of semaglutide is reached 1 to 3 days after the dose. For elimination, the clearance, which is the volume of plasma cleared of a drug over a specific time period, is 0.05 liters per hour, and it's mainly cleared by the kidneys. The half-life, which is the time for the amount of active drug in the body to reduce by half, is 1 week. This long half-life is attributed to serum albumin binding, which protects semaglutide from metabolic breakdown, as bound drugs cannot be metabolized or excreted. The fatty acid chain attached to lysine at position 26 allows for this high albumin binding. It takes 5 to 7 weeks for the drug to fully exit the body via urine and feces. The volume of distribution is between 8 and 9.4 liters. The volume of distribution relates the amount of the drug in the body to the concentration of drug in the plasma. Semaglutide's volume of distribution is low due to the drug mostly being confined to the blood plasma rather than tissues due to this high albumin binding.
Semaglutide has many different ways of regulating weight loss, starting with appetite regulation. It's able to influence brain regions which are involved in the regulation of feeding through several proposed routes. So there's homeostatic feeding and non-homeostatic feeding. So homeostatic controls energy balances by adjusting your food intake to prompt stability in the amount of energy stores. So this matches how much energy is expending and how much energy is being consumed. And then non-homeostatic feeding, also known as hedonic feeding, can override this pathway, which results in overeating. It's not regulated by hunger signals, but by rewarding properties and motivation related to foods, which involves reward, cognitive, and emotional factors. There's also delayed gastric emptying, which slows down the rate at which food leaves the stomach and enters the small intestine, which leads to a prolonged sense of fullness, reducing food intake. And then it also enhances the secretion of insulin in a glucose-dependent manner, which means it increases insulin release only when blood glucose levels are elevated, which can improve blood sugar levels and reduce risk of hypoglycemia. And then it increases energy expenditure and promotes fat burning, which will reduce body weight and improve body composition. And it can also have a positive impact on lipid metabolism, which can favorably change cholesterol and triglyceride levels. These all make it a very effective weight loss medication, but it must be used as a part of a comprehensive weight management program that includes a healthy diet and exercise.
From the years of 2018 to 2022, semaglutide saw an 88% increase in rank in the most prescribed medications in the US list over those 5 years. In 2023, it became the #1 top-selling medication, although it did not make it into the top 50 of the most prescribed medications of that year, which indicates that many people were buying semaglutide online without a prescription. In a poll conducted by KFF.org, it was found that 9% of people polled were taking semaglutide without having diabetes or being overweight or obese. These people were possibly taking the drug without doctor guidance. While 79% of people who were taking a GLP-1 drug were getting the drug from a primary care doctor or other medical specialist, 21% of people were not getting the drug with a prescription. This means that they were buying the drugs online at a medical spa or other locations. These drugs could be non-FDA approved knockoffs that can contain banned or illegal ingredients, substances that are not written out on the label, contaminants, or may not contain the amounts or concentrations of ingredients listed on the bottle. A reason so many people may be turning to these non-trustworthy sources to get semaglutide is that drugs like Wegovy run for $1,349 without insurance coverage, and only certain insurances cover the drug, only if you have a BMI over 30 and require the drug to prevent further cardiovascular illness. Some health experts believe that the proliferation of GLP-1s is over-medicalizing a condition that needs to be addressed structurally. This line of reasoning holds that factors including urban planning and the lack of cheap, nutritious food are causing the US obesity epidemic. Semaglutide is not a cure for obesity and is being treated as such by the media. One consequence of this is that in 2023, a worldwide shortage of semaglutide occurred due to its popularity, which resulted in the UK stopping new prescriptions of the drug. This meant that people who needed the drug for type 2 diabetes were no longer being able to access it.
Hey, can we talk about something?
Yeah, what's up? I know you've been a little off lately.
Remember I've been trying to lose weight? I may or may not have taken your diabetes medication and then bought some weird semaglutide pills online.
What? You stole my pills? No wonder I've been short recently.
Yeah, I feel really bad about it and I want to get off my chest. And if it makes you feel any better, they didn't even help me lose weight.
Well, thanks for being honest with me. But I think I'm gonna lock up my meds from now on.
Don't steal and take prescription drugs that aren't your prescription.